is systemic lupus. We're not touching on the neonatal lupus or drug-induced lupus and predominantly cutaneous lupus. We're discussing systemic lupus. Now, systemic lupus may affect every system of the body, but usually it will affect the skin, the lungs, the kidneys, and very often the brain. And when it affects the brain, it may present in many different ways, and one of the ways is psychosis, where a patient may have some difficulty in organizing his or her thoughts. Yes.
Most of the time, these patients are misdiagnosed. Why is this?
I think that misdiagnosis may occur in a variety of settings. In order to diagnose lupus, one needs to have what we call a high index of suspicion, and also the nature of the disease itself. It presents in so many different ways. It can masquerade as any other disease. For example, a patient may present with just joint pains, and if you're in a rural area where there's a lot of malaria, it might appear to be malaria. The patient may present with a cough, and if it's in the rainy season, someone might think it's just a flu. And in addition to that, one needs a lot of expensive lab work to be done in order to arrive at the specific diagnosis. So when you put all these together, it can be very challenging to arrive at a diagnosis.
Most of these patients are actually misdiagnosed with thyroid and sometimes arthritis, some of them. What are some of these symptoms that we can look out for one maybe to rule out lupus as a person before maybe we go too much into the lab work?
Okay. First of all, lupus there are a few things that we need to know about lupus. Lupus tends to be a disease that clusters in families. It tends to be a disease that clusters in families. In other words, if one person has lupus, then another first-degree relative may have lupus.
And what are the chances?
Well, we don't quite know what the chances are. It's very difficult to calculate that, but we do know that there is some clustering. Secondly, it tends to be a disease that's more frequent among women, especially in the childbearing age groups. Outside that range, for example, pre-puberty, it is still more common among women, but the ratio is only about 2 to 1. Among childbearing women, that's say 15 to 45, you find the ratio of women to men goes up to about 12 to 1. And then post-menopausal, the ratio comes down again to about 2 to 1.
Why women?
In favor of women.
Mm-hmm.
Now, I know what you're going to ask next, but before I get there, when it does occur in men, it tends to be very much more severe on the whole than when it occurs in women.
Mm-hmm.
So why does it happen? Why does it occur in women? We think that there are hormonal factors that are playing a role in the onset of lupus, but we're not quite sure exactly what role that is. Research has been done that has shown a number of trends, but there really isn't any uniformity to allow us to make very much in the way of conclusions about what hormones exactly do.
In your field of expertise, are most of these patients, are they born with it, or does one acquire it? Can it be maybe transferred from one person to the other?
Okay, lupus is not spread it's not a contagious disease. You don't get it by touching someone. You don't get it by sharing a meal with someone. It's not even sexually transmitted like other illnesses. If someone coughs in your face, you're not going to catch lupus. So lupus is not an infectious disease. How does one get lupus? It's a condition that tends to be acquired from birth, although there are no tests as such that one can apply at that point to show whether or not the patient has it.
So sometimes chances you're born with it.
There are genetic and environmental factors. There is a very complex interplay between genetic and environmental factors. For example, some people may be predisposed to it, but they don't get it. And so there are other factors that we believe come into play which may trigger the onset of the problem. Exactly what those factors are, again, we're still not sure. We've looked at breastfeeding, we've looked at alcohol, we've looked at cigarette smoking, we've looked at coffee, we've looked at even just motor car oils, and there are some researchers that have found some association. Others have not been able to duplicate some of those associations.
Can it be immunized or prevented or even cured at some point?
There is no cure for lupus, but lupus can be controlled to the point where individuals with lupus can lead fairly normal lives. Now, around the turn of the century, if we go back in history, around the 1940s, if you had lupus, you lived for about, only half the patients would live for 3 years. That was way back in 1940. And then in 1948, there was a major discovery of a drug called cortisone, and that really revolutionized the management of lupus. And further discoveries have now led to the point where the 5-year survival and 10-year survival are about 90 and 80% respectively, which in effect means that patients who have lupus, if they're well controlled, they're diagnosed in good time, can essentially lead normal lives.
So once a patient is diagnosed, medically, what process do they go through? Is it a diet they go through? Is it medication? Is it therapy? What exactly happens to a patient with lupus?
Once a patient is diagnosed with lupus, then the focus is on the predominant symptoms that the patient is presenting with, because not everybody presents in the same way. And the symptoms are going to essentially drive the management of the lupus. There was a question on diet. I guess I can answer that right now.
Sure.
We know, for example, that many patients with lupus are challenged by cardiovascular diseases. They develop a process known as atherosclerosis, which can lead to different heart problems. So one of the things we do is advise patients in the kind of low-fat diets that they need to take. For example, if you're eating chicken, you want to eat chicken without the skin, because the skin has a lot of fat. You also want to avoid red meat if you can. You want to focus on fish, and you also want to have a plate full of vegetables. And then also, you'd probably like to eat your meals in small, frequent meals rather than 2-3 large, huge meals. And then you want to avoid nocturnal huge meals, at night before you sleep, so that your main meal is probably in the morning or lunchtime.
Maybe physically or environmentally, what should change for patients with lupus? Is there any special way they should carry themselves or they should be treated?
I don't think environmentally there's really very much one can say, because we really don't know very much about the environmental trigger factors. So, but generally, of course, one is going to want to do things like you want to avoid smoking. So even though smoking may not have been strictly related to as a cause of lupus, although in some studies there is a tendency for that, you want to avoid things like smoking.
Thank you. Before we continue, we'll pick a question or two from the audience.
Okay, my name is Justin Bakora from King's College. A doctor has said that there is no cure for lupus. Like now, HIV, we have ARVs, the drugs that prevent, they control the disease. So are there drugs for lupus? Then my second question, is there a vaccine for lupus so that we can actually help the young ones? Thank you.
The first question, yes, there are drugs that can be used for managing lupus. Just like you have ARV drugs, the drugs that are used for lupus are directed at controlling the inflammation that the patient experiences. So there are a wide variety of drugs, including the cortisone that I mentioned earlier. Second, as for a vaccine, vaccines will normally be used in situations where you have an infectious disease that is causing the problem. Lupus is not caused by the infectious disease, so we don't give vaccines to control it. Yeah. So as far as prevention is concerned, I think education is probably the best thing. Being aware of how the disease and the circumstances in which the disease occurs is probably, and educating oneself about it is probably the best way to go.
My name is Kiran Keramo. Okay, I'll ask this. Something that I've noticed with everybody who's talking here is the first time they heard about lupus, most of us it's now, and for the affected ones, it's when it affected them that they knew about lupus. So we can see in the cases of other diseases like HIV, cancer, we have groups which create awareness, but does this disease have such groups? Because personally, today is the first time I've heard about it. Then you have said that there is a drug-induced. Which drugs?
Let me answer the second one first. Which drugs? There's a drug called hydralazine. Hydralazine is a drug that we've used for very many years for hypertension. So individuals who have hypertension used to be given, and some are still given in some circumstances, hydralazine. And that's one of the drugs that can cause it. There's a drug called procainamide, which is also used in the hospital and also known to probably predispose to drug-induced lupus, and a variety of others. To answer the second question, it's very difficult to see why very few people know about lupus, but I think we have a group of very courageous individuals here with us today who are coming out and saying very openly that they have this problem, and I think that's a step in the right direction. So that individuals come out, they say that they have the problem, and they say it's not the end of the world that you have the problem. So that leads to more education, it leads to greater acceptance, and it also leads, I think, to less stigmatization of the disease itself. Another reason, I think, is it's a rare disease, relatively rare disease. It doesn't attract as much attention as cancer or HIV or diarrhea or malaria, and not much money is also put into it at the national level. So for those reasons, then it takes a back seat and it doesn't get as much media exposure. So I think we should also thank KBC for coming out with this and airing it, because that's one step forward in disseminating information on it.
Many people with lupus occasionally have flares. What are flares, doctor? I want to understand more about flares.
Flares is a term that we use to describe a state in which a patient with systemic lupus develops increased activity of the disease. The disease is characterized by what we call relapses, that is when they fall ill, and remissions, which is when disease activity goes down and they feel better. A loose term for relapses is flares. When patients with lupus, for example, are exposed to the sun, they are at risk of developing flares because for some strange reason, the sun will usually activate disease in these individuals, symptoms such as joint pain, fever, and they may even develop psychotic episodes. So the sun is something that patients with lupus need to be aware of, and for that reason we encourage them to wear hats. We encourage them not to stay in the sun for too long. We encourage them to put on a cream called sunscreen, which absorbs ultraviolet light and prevents them from the sun from triggering what we loosely call flares. But flares is essentially what a relapse is.
What is your advice to maybe family members with people, with patients of lupus?
I think that my advice is to family members is first to the spouses, because the vast majority of patients with lupus are women, and they're women in childbearing age group. And the spouses really need to be understanding and need to be educated about the problem, otherwise it can lead to a lot of conflict. Another reason is because a lot of patients with lupus may experience miscarriages and may try several times to have children and not succeed. And this, if it's not understood, can create problems within the marriage situation. So health education is extremely important for all members, but particularly spouses that they live with.
Thank you so much, Dr.
Thank you very much.